Afternoon, everybody. It is June 10th. This is the Thurston County Board of Health meeting, and it has come to order at 3:49. And the first item on our agenda is to see if anyone has any additions to the agenda. And if not, I will take a motion to approve our agenda.
I'll move to approve the agenda.
All right, Ms. Nelson, and second,
Second that.
Heidi Knadel, and all in favor of approving our agenda?
Aye.
And any opposed? No. So motion has passed and we will move forward. The second item on our agenda will be to review the meeting minutes from last meeting, and I hope you all had time to do that. Are there any additions or corrections? And if not, I will take a motion to approve the May 13th, 2025 Board of Health meeting minutes.
So moved.
All right, great. You got that? All right, all in favor?
Aye.
All right. Any opposed? Nope, don't see any online. So the May 13th, 2025 Board of Health meeting minutes are approved. And next order of business is to proclaim the month of June 2025 as Gun Violence Awareness Month. And I don't know, we were going to invite Ramona Smidala and Ed Humble to the table to say a few words. And I hope I pronounced your name correctly. Okay. Welcome.
Thank you. So my name is Ramona Smidala. I'm the Mental Health Education and Outreach Specialist for Thurston County in the Parent-Child Health Division. And I just wanted to talk about the Lock It Up program that we're doing. So in addition to the data that we have listed there on the proclamation for you guys, there is a lot of statistical information that shows that gun violence is a big issue at current time. And so we have started a program with with King County called the Lock It Up program, where we are trying to educate people about safe storage for gun locks and other devices. And we are actually giving them out. I gave out about 30 of them today at a different event. So yeah, we're really just trying to get more safety devices out there for community members who maybe can't afford them. Perfect. I'll turn it over to.
My name's Ed Humble. I'm with Thurston Gun Sense, and I just wanted to take a few minutes of your time today and just explain what Thurston Gun Sense is and who we are and what we do, and applaud you for the proclamation that's in front of you today. We're a group of citizens in Thurston County, formed in 2015, so we've been around 10 years now, and began. I wasn't involved in 2015. Still working and not retired, so I couldn't get involved in things now, but now I can follow my passions. And we are a group of citizens that have a passion about, let's solve this problem. Let's solve this problem in our county. Let's solve it in our state. Let's solve it in our nation. Let's deal with this. And so we've been working at it for about 10 years. The things that we are associated with, you may have heard of the Alliance for Gun Responsibility, that is a statewide. Their offices are in Seattle, they're statewide. And they do a lot of legislative activity and have been responsible for a lot of very positive things legislatively that have happened in our state over the last number of years. We work with them. We're kind of, they have groups around the state that are subsidiaries of them, and we're one of those. And so that we're associated with them. The things that we do, the free gun locks, which really goes in within your proclamation, you say you want to, let's take care of the access to guns. And so we've been distributing gun locks for a long time. We go to events all over the county. We're at every week when they have music in the park with the Lacey schools. We're at all of the main events that happen in Olympia, and we've really tried to spread out and get out. We've gone now for 3 years to the Oregon Trail Days in Tenino, and we are so well welcomed there. You get out into the more rural areas, there's more people that have guns for just a lot of reasons, and they have them for very legal reasons. We're not trying to deal with any of that. We're trying to say, if you have them, let's lock them up and let's keep them away from kids, and let's know how they're used. So we have a lot of materials. And so we've been 3 years to the Oregon Trail Days. We're going to Rainier this year as well. And I think we're still working on some other events around the county and be able to we distribute gun locks and gun safes. So we're excited about that, and it's growing, and our ability to get more gun locks is growing because people are helping us more. We've gotten a lot of help from the sheriff's office and police the city police in different locations around the county. They've given us help to have those gun locks, so that's been really good. The other things that we really stress are the education and outreach. You know, what's happening to our country, what's happening to our kids. We really want to do that. We get into suicide prevention. We always, a lot of us talk about, but it's terrible that the number one killer of children in our country is guns. But when you look at what percentage of that, even that, within that, is suicides, we've really got to deal with that. And a lot of it is keeping that away from, not having access, but a lot of it is education and other services to kids that we try to do that. We've done some candidate forums. This is kind of get into working with the Alliance, the legislative advocacy we do, and we really are involved in get out the vote when it's time to vote, and get out the vote with legislators when it's time to vote on specific bills. And we have some of the best bills of any state in the country in Washington State, and we should be proud of that. Thank you for inviting us to be here, and I told her I'd get all this in 2 minutes, so I talk real fast. And I don't know if I made it or not, but thank you for inviting us to come. Thank you for allowing me to let you know who we are. We always wear orange. We got a couple of our members, or at least one of our members and one of the mom's members, so we love them too. So we have, any event we go to, we wear orange. That's why I'm wearing my orange shirt today. And thank you for allowing us to come and address you.
Great. So we will read the proclamation and then we'll take a photo. All right, are you okay starting, Perla?
Yeah, I'd like to first point out, thank you so much for coming. I am very passionate about responsible gun ownership, and I worked in the ER for over 10 years, and as we said in the ER, there's very few accidents. So sometimes having access to firearms can result in catastrophic injury, and not even death, but injury. Taking care of
Yep.
people, kids whose whole life is affected. Yeah, that's tough. So thank you so much for getting the message out and working to make kids safer.
Thank you.
I appreciate it.
Your passion comes through, so
And
thank you
any
for that.
other questions or comments before she starts to read
I
it?
do have a comment.
Okay.
As a crisis mental health provider for a lot of years, I know the value of slowing things down with preventing big problems with youth, including suicide. I respect so much what you're doing. The practicality of your work with gun locks will slow a youth down enough to think about it, not to do something really reactive in a situation because of the moment that they're in. And so I really honor you for that. So thank you for your work.
Thank you for that. Appreciate it.
Just want to echo what they said. Don't want to take too much time, but we really, really appreciate it. Thanks for coming.
I'm having a new understanding and sort of a question here about the, between 2019 and 2023, there were 620 stolen firearm incidents. And I hadn't thought about gun safes and gun locks as a way to prevent burglaries from including taking your firearms. And so I appreciate your calling that out in the proclamation.
One of the things that we just started just this last summer having available to us, and boy, and we asked people questions before we gave it to them, because I don't want to see it on eBay the next week, but I want to give it to people that are going to use them. But we have these gun safes that have, I wish I would have brought one to show you, that you lock the safe and then you can lock the safe around something else. So you could have it locked into your trunk so that it couldn't be stolen out. The gun is safe because it's locked in, and the safe itself is safe. Sorry to overuse the word here. It's,
You can't overuse it.
and so those, and those have been very popular. And I wanna, you know, and it's hard to get statistics, but we gave a lot of those out last year. That group, the King County group has helped us with some funding to get some of those. And we've got some other groups that are helping us with that as well. And so I believe down deep, we've prevented some from being stolen.
That's important. I was actually present when someone had to report their stolen firearm from their car in the ER waiting room. So,
Yeah,
and it
see,
was our
there's the-
security personnel, so it was his personal firearm, so it's wild. Yeah, so on that note, should I start?
That would be
Okay.
wonderful.
So Thurston County Proclamation Gun Violence Awareness Month. Whereas June is recognized as Gun Violence Awareness Month, a time to honor victims, support survivors, and commit to safer communities. As we remember those affected, we also promote responsible gun ownership, including safe storage practices that help prevent tragedy. Together, we can raise awareness and take meaningful steps towards ending gun violence and
Whereas since 2018, Washington State has seen a steady increase in the number of firearm deaths. And
Whereas between 2019 and 2023, there were 4,677 firearm deaths in Washington State, with more than half of these deaths being suicide by firearm. And
Whereas between 2020 and 2022, the Washington State Department of Health reported that approximately 1/3 of emergency department visits and 1/3 of hospitalizations due to firearm injuries occurred in young people ages 0 to 24 years old. And
Whereas according to the Behavioral Health Risk Factor Surveillance Surveys conducted between 2013 and 2022, on average, 45% of surveyed Thurston County firearm owners reported storing their firearms securely. And
Whereas between 2019 to 2023, there were 620 stolen firearm incidents. And
Whereas by encouraging our community members to store their firearms unloaded and locked, we can reduce the number of firearm injuries and deaths, as well as reduce access to firearms by those who may be in crisis and prevent further unauthorized use.
Now therefore, be it resolved, the Thurston County Board of Health hereby proclaims June 2025 as Gun Violence Awareness Month in Thurston County and urges residents to honor the lives of those lost through participation in community service and remembrance ceremonies, as well as encouraging others to securely store their firearms to prevent unauthorized access and reduce future injuries.
all right, should we go take a photo? All right, we're gonna go head out to the stairs. And we have invited Neil Sharp to the table to say a few words.
Thank you, Dr. Harvey. As she mentioned, I am Neil Sharp. I work for the Public Health and Social Services Department in Population Health. And so thank you for letting me speak today in support of proclaiming June as Men's Health Month in Lewis County, or I'm sorry, in Thurston County. I thought I was going to be less nervous sitting down, but I think I would have been better on the podium. So, it's an opportunity to shine a spotlight on an issue that too often goes unnoticed: the health and well-being of men and boys in our community. Across our county and the nation, men face significant health disparities that deserve more attention. Men are more likely to die prematurely from heart disease, cancer, overdose, and, of course, suicide, many of which are preventable with early intervention. Here in Thurston County, local data reflects these national trends. Men experience higher rates of overdose death and are less likely to seek timely health care or mental health support. We know that behind these statistics are fathers, sons, brothers, coworkers, neighbors, and friends, people we care about, people we love. Too often, stigma, silence, or simply a lack of awareness stand in the way of getting the help that's needed. By proclaiming June as Men's Health Month in Thurston County, we send a clear message: men's health matters. We can use this time to promote access to care, encourage routine screenings, and support programs that address mental health, substance use, and chronic disease prevention, especially those that meet men where they are, including in rural, tribal, and underserved communities. More importantly, this proclamation tells fathers, brothers, sons, and friends, your health matters, your life matters. Let's use this month to partner with health providers, community organizations, and local leaders to remove barriers and build a culture where seeking care is a sign of strength and not weakness. Together, we can help close the health gap and build a healthier future for all of our citizens. Thank you.
You shouldn't have been nervous. You did great.
Great.
Would you be willing to start reading the proclamation?
Sure, I'm already crying, so we'll see how this goes. All right, Men's Health Month. Whereas Men's Health Month, observed in June, serves to raise awareness of the unique health challenges men face within our community, reduce stigma associated with seeking care, and promote equity in access to support for both mental and physical health concerns. And
whereas men on average live about 5 years less than women and have a higher death rate for most leading causes of death, including diabetes, suicide, cancer, and heart disease. Heart disease is the second leading cause of death for males in Washington State and the first leading cause of death in Thurston County. And
Whereas nationally, men make half as many physician visits for prevention as women and are more likely to be uninsured. And
whereas in 2023, nearly 3/4 of tragic deaths due to both homicides and overdoses in Washington State occurred in males, which often stem from systemic issues that can be addressed with effective prevention interventions. And
Whereas in the United States, 6 million men are affected by depression each year. Men experience more than twice the number of deaths from alcohol-related causes than females, and increased suicide rates among males, which in 2023 was 22.7 per 100,000, and is nearly 4 times the rate of females at 5.9 per 100,000. And
Whereas, whereas June 13th will be Wear Blue Day to increase awareness of men's unique health issues, challenges with accessing care and mental health support, and to promote prevention through healthy lifestyles with regular screenings of blood pressure, cholesterol, glucose, colorectal health, and prostate health.
Now, therefore, be it resolved, the Thurston County Board of Health hereby proclaims June as Men's Health Month in Thurston County and urge residents to acknowledge and support men in our community to reduce stigma with accessing health care essential to achieving the highest level of health and well-being for everyone.
thanks, and we will not do a photo on this one, but we still appreciate you coming in
That's the
person.
worst part of this is I didn't get a photo.
Thank you so much.
Dr. Harvey, can you make a comment?
Oh, yes, yes.
When the Education Subcommittee reached out to a man on the committee and said, well, who should speak to men's health and wellness? I had no idea. And I realized I'm somebody sitting with an unscheduled physical, colonoscopy, dental exam, vision exam with the little reminders all, and so don't be a knucklehead like me and take care of yourself. Yeah.
You're important.
Thank you again.
Thank you. All right, so we will now proceed to the next order of business, which is to provide an opportunity for the public to address the board. And let's see, and we have 3 people signed up. And so I'll first just read kind of the guidelines, and then we'll call you up in order, and we'll have you go to the podium. So Thurston County Board of Health welcomes comments from the public at all meetings. The following are guidelines for public testimony to ensure they are appropriate and do not take advantage of the televised nature of the meeting. All individuals testifying will provide their name and address. Testimony will be addressed to the Board of Health members, not the audience, cameras, or staff. Cell phones will be silenced. No response is provided by the Board of Health following testimony. As needed, the Board of Health clerk will follow up with specific items. Speakers are limited to a total of 3 minutes. Speaking time may not be shared between individuals. The Board of Health reserves the right to restrict an individual's opportunity to address the meeting for good cause. Lewd, offensive, inflammatory, hateful, defamatory, or discriminatory comments will not be allowed. All materials provided to the Board of Health may be considered public record and subject to public release upon request pursuant to the Public Records Act, Chapter 42.56 RCW, and no outbursts of any kind. No comments that are commercial in nature, such as promotion of a for-profit business. So first, I would like to call Mr. Trowbridge to the podium.
Hello there, I'm Brett Trowbridge from Patterson Lake. This is the 4th time that I've been here to talk to you folks. The first time was in March, and if you remember, that was when Stu Whitford was here from Environmental Health and was talking about herbicide use. He presented what was called the prescription at that time. You guys all passed it all. If you remember, what Stu said was, we should be using herbicides less and only when really necessary and when there is no alternative. So if you remember, I shared with each of you a sheet of paper showing the 3 categories of aquatic herbicides according to Thurston County Department of Environmental Health. Glyphosate was rated worst. The 2 herbicides the steering committee wants to use here, endothol and imaprazir, are rated as conditional. And there's a whole bunch of them that are rated as okay. So the question here is, why is the steering committee wanting to use these conditional ones when there's ones that are rated okay? And remember what Stu said about that was that conditional means that there's got to be some special condition warranting doing this, a great public need. Here it's boating through the trestle, which doesn't seem to me to be much of a public need. Also in March, I showed with you a copy of the map showing that many properties were left out. Each one of you got a copy of that. Yet the petition says all lakefront properties were included. How can you claim these same properties should be treated? If you can't just leave out properties and then treat them anyway, how can that be fair? This has never been done before. There's never been any time where they've left out a bunch of properties and then tried to treat them. So at the April meeting, I talked about the McAllister Springs geosensitive area. For the last month, Dr. Harvey's had the book that I was quoting, and now Commissioner Klaus has it, and I hope she'll share it with other people, any of you that want to look at it. The geosensitive area was established by you guys, the Board of Health, in 1990, and I shared with you citations from that book, as well as the fact that it's coded in the Thurston County Code. It's called the Geo Springs Geosensitive Area, and people like me and my wife who have 86 acres there are restricted 1 house to 5 acres for building, so it's considered to be a big deal. And why? Because our lake feeds the drinking water supply for most of the county. So last month I decided not to say anything because some of you were complaining I was too loquacious, but I shared with you a document that I had written, and I also sent you each a copy of the Thurston County case from 1945, which establishes that the bottom of the lake is owned by each waterfront owner, not by the state of Washington. Incidentally, Commissioner Fournier asked the Civil Division of the Prosecutor's Office for an opinion on that, and somehow they declined to give one in special circumstances, I guess, where they don't want to. Now, this case exists. I didn't make it up. They don't have a case that says they have jurisdiction over the lake. I did not make up McAllister Springs. There it is right there in that book. And I was not the one who left properties out, including the 500 feet of lily pads owned by me and my wife.
Mr. Trowbridge, I hate to
I
tell
was
you,
not the
but
one
we're
who
we're
decided
out
that
of
our lake
time.
should not have any conservancy areas. But I do offer solutions.
Yeah,
First, lily pads can easily be controlled by ground seeding or harvesting. Allow no aquatic herbicides. Stu Whitford's
Trowbridge?
document says harvesting costs 2,400 per acre per year, and herbicides 1,600 per acre per year. So
Mr. Trowbridge?
herbicides are not exorbitant.
Your time is up, sir.
appreciate you
Thank
coming.
you for being so welcoming.
Thanks for loaning
I'll see
me
you
the
next
info.
month.
Okay, see you soon. Thank you. All right, our next person we will call to the podium is Don Leaf.
My name's Don Leaf. I have been living here in Thurston County for over 50 years. I've served in the Thurston County Health Department for 27 years, and I'm now retired. I'm a registered sanitarian and am retired. I'm not active in that. My request of the Board of Health is an unusual one. In the national sense, at the federal level, we're getting very, very weak support for public health. And in fact, some things can be called disastrous. In the absence of strong public health resources at the federal level, the results, the responsibilities and actions fall more on the local level. RCW 70.05 clearly gives the local Board of Health a substantial responsibility and a substantial ability to take care of public health issues, control of infectious diseases, et cetera. I'm not suggesting that you should be added to that. I am requesting one thing, and that is, in the absence of a strong vertical resource to the federal government, I would urge you to emphasize and encourage lateral responsibilities and lateral information. This Board of Health ought to investigate and cooperate with other local boards of health, other local health officers, and encourage both the Board of Health members and environmental health and public health staff to cooperate with other health department resources. Public health and the need for public health will remain after and during this present federal administration. You guys, all of you, have a substantial responsibility now and after or at the change of administrations, and that won't change. The responsibility is still there. Your administration can choose, make things more easier or more difficult for staff and for yourselves to talk to and share policies and share directions with other entities that may be experiencing the same thing. So I encourage you to investigate and act laterally in the absence of clear vertical support. That's all I have. Thank you.
Thank you so much for coming.
I'd entertain any questions that you have of me. Thank you.
Thank you.
And then we have Brett Buckley.
Members of the Board of Health, not my normal forum for speaking to folks here, but I got an invitation from Commissioner Klaus saying, hey, would you come speak to the Board of Health? I'm thinking, why me? And then she forwarded a proclamation, so I read it. I said, oh, now I get it. She wants to find some 71-year-old who's, male, who's gone through all those embarrassing things that we older guys have to go through, and somebody who would be willing, of course, to say it out loud. So I'm here. Thank you very much for the invitation. So yes, I go to my doctor and I schedule my PSA test annually, which tests for prostate cancer. So far, so good. I get my blood test so I can check my genetically high cholesterol levels and do the things I need to do to not keep them, or have them remain so high. I get my regular colonoscopies. So if my doctor's listening, I know, I'm scheduled. I get my vaccines. I get the flu vaccine every year. I get the COVID vaccine now that we need to do that. So for men, we can do these things. I know Clark said he has a hard time committing to them, but Clark, get out of your seat and go do these things. Anyway, I don't want to say I'm living proof that they pay off, but I do the things that I'm supposed to do, and we men can survive those things. I can assure you of that. Out of some sort of interesting coincidence, this thing showed up on my desk this morning, and for those who don't know, I'm the mental health court judge and the veterans court judge for Thurston County. And this is a staffing report, just came in today, for somebody who's been referred to mental health court. And let me just read some things which are, this is an example, a personification of what is set forth here in the proclamation. So this person, a male, comes to us with diagnosed severe depression and a person who has dealt with alcohol abuse his whole life. He lives alone. His father died of alcohol-related issues. His mother died of alcohol-related issues. His grandmother died of alcohol-related issues. His grandfather died of alcohol-related issues. And he reports, not surprisingly, that as a child he suffered abuse at the hands of his parents, and he remembers that abuse occurring always around alcohol use. So the proclamation speaks directly to that. The experience that we have in our therapeutic courts speaks directly to that. This is not unique. This scenario is something that occurs frequently and leads to conversations that we have on a regular basis in court, which aren't conversations we would normally have, which is this connection between physical health and mental health. So, we have people who fit that description. They live alone, they play video games 25 hours a day, or they don't get off the couch. So we do things like, let's talk about your nutrition, your diet. Let's cut out the sugar as much as we can. Let's start drinking water instead of the other stuff you're drinking. Let's work on things like, breathing. Maybe wake up in the morning and start taking deep breaths. And maybe if you get good at it, you can do a breath of fire. You can all Google that if you're not doing yoga and you'll figure it out. But these are things we talk about in a court. And then we talk about getting outside. And one of my favorite things to talk about is what the Japanese call forest bathing, which is you leave the city and you go into the woods and you walk, even if it's a drippy day out there, and you just listen to the water droplets come down and hit the ground. You listen to the birds sing if the birds are out, and your anxiety dissipates. And it really adds to your sense of calm, and the depression that you may feel gets lifted when you get outside. And if it's a day like this, get vitamin D, which is helping in that regard. So we are implementing a lot of these things in the modality of the court system, addressing the issues that Neil was talking about in his report. And I also want to, the Thurston Gun Sense folks are also dealing with a very significant problem, which plays into this problem. The vulnerable populations that we deal with, the mental health and veterans court, in keeping them away from firearms is so important, because that is a real risk that they face, and they understand that we talk about. Thank you all for highlighting all of these very important issues.
Thank you so much for coming.
Thank you.
All right.
Chair,
Yes.
I did have a written comment that came in. I will forward to the board. If it's okay, I'd like to read it. It's just a couple paragraphs from a constituent who planned on coming in today but had something come up. If that's not okay with you, then I'll just forward it to the board.
It's okay with me. You're okay.
Okay. Okay, thank you. I'll be quick. So this is from Keoki Kauuanoi. Some folks might know him. He works for Family Education Support Services. He says, "Aloha and thank you for the opportunity to speak today in strong support of this important proclamation recognizing June as Men's Health Month here in Thurston County. My name is Keoki Kauuanoi and I teach parenting classes at Family Education and Support Services, or FES. In our fathering classes, we talk about how our children are wired to learn through mimicry by copying what they see us do, and because of that, anything we want for or from our children, we must ourselves be. If we want our kids to be respectful, consistent, and dignified, then we have to role model respect, dignity, and consistency to them. In all of our thoughts, words, and actions, including our own self-care, if we cannot care for ourselves, we will not model self-care for our children. According to the National Fatherhood Initiative, children who have engaged fathers in their lives are at a lower risk of low birth rate, injury, teen pregnancy, alcohol and substance abuse, and suicide. At FES, we are so happy to support and endorse such a worthwhile proclamation. Our own mission is to inspire healthy child development through the provision of quality family support services. We wrap services and resources around anyone caring for a child, be they biological, non-biological, adoptive, foster, or through kinship. In my classes, I see every day how the health of men, fathers, grandfathers, brothers, sons, ripples across families and communities. When men suffer in silence from untreated depression, unchecked chronic conditions, or addictions born of isolation, families suffer too. Children lose not just their caregivers, but their role models, their support systems, and often their sense of emotional safety. This proclamation is not just about extending lifespans, it's about improving the quality of life for men and the people who love and depend on them. We cannot ignore that men in Thurston County are dying younger, especially from heart disease, suicide, overdose, and preventable conditions. And we cannot ignore that the shame and stigma around seeking help, especially for mental health, still silences too many men. June 13th, Wear Blue Day, offers us a collective moment to stand together and say, men's health matters. Equity in healthcare includes gender equity. Let's encourage our fathers and sons to go to the doctor, normalize therapy for men. Let's talk about mental wellness in locker rooms, job sites, and living rooms. Let's advocate for policies that make care affordable and accessible for all men, especially those most marginalized. Thank you for declaring June Men's Health Month. Let this be a call to action to build a community where every man has the opportunity and the support to live a long, healthy, and connected life. Dads, your health is their head start. Thank you, Chair. I appreciate it.
All right, so now I'm gonna let Dr. Freiheit give us an update on a meeting that Commissioner Mejia, members, and Zolly Marshall and myself had, and then we'll give you a little update.
Yes, thank you. I'm in Blaine, Washington at the WSALFO Summer Annual Conference, so learning a lot more about federal funding and FPHS, so more to come. But I just am going to key this up for you, Dr. Harvey, as the chair. This is in response to an email that members in Zolly Marshall sent all of us regarding some items, potential improvement forms, things of that nature. We had our first meeting, went over the first several items, but did not complete the whole entire list. So I will turn it back over to you, Dr. Harvey, to give a brief on what the result of those items were.
Great. Yeah, so we kind of just started from the top and went as far as we could, and then we'll have a follow-up meeting to address the final ones. So the first thing is we talked about whether we needed an agenda item request form. And what we decided was, instead of a form that any of you can send an email to the Board of Health clerk 2 weeks prior to the meeting to make a suggestion. And then if we don't get to your item, we will update you and the board, and we'll be tracking items so that you know they aren't getting lost or just buried. And we welcome your input, and we want to make sure you all feel that that's easy. And you can always, on that, CC Dr. Freiheit and myself if you would like. But most important is getting to Melanie. She'll get it to the right person. Let's see. And then we just wanted to make sure that you had transparency about any of those suggested items. So we'll make sure there's a way that you can see what we're following. Okay. And then other ideas, of course, welcome. If you're like, think of a better way, but we thought that was pretty concise, simple, and easy to do. And then we talked about conflict of interest forms and just making sure it was very clear that we all understood, how we would approach that if we had a conflict of interest. And it is in the Board of Health bylaws currently, and we don't feel like we need any action, but we will make sure that everybody has that review every year and understands, and that we reiterate we have that policy in case you want to read it. And then we had a discussion of quarterly or annual training, and we'll kind of do an interest survey just to see if there are topics or trainings or things that I think we would want to be able to understand better. And I think that was the main things we got through, so.
You said there will be an interest survey on, is that what you said, for trainings? Okay, will that be coming out via email?
Yep.
Okay, awesome. Is that gonna be like happening soon, or will there take time to put that together?
It will take some time to put together. We have to figure out exactly what the questions are that we're gonna be including in there. So yeah, we'll have to kind of develop that a little bit. So it'll be coming out, but not immediately.
Okay, thank you.
Just if you can make sure that you include, there are some required trainings, so the open public meeting, make sure everybody knows that they need to.
Yeah, we'll be tracking the like required versus optional and thanks. Yep. All right. Any other questions on that? Anything you want to say, Tanzania? Okay. Right, you're on mute, so I think you're saying it's okay.
No, I was trying to I have a couple different screens going on. I'm so sorry. Yeah, I think the conversation went well overall. I think the only thing that I would add here is that I am definitely welcome to other people being a part of those conversations. I know that when I initially brought this up, that some people had interest, but maybe in different areas. So somebody might have been, there might have been energy behind a certain form, or somebody might have been excited about, a specific system that will help us as board members get our work done. And so I have my perspective, I have my thoughts, but I'm sure there are other people that have been doing this in different spaces. We have elected officials that have a lot of experience in this area about being supported and what it looks like for a well-oiled machine to move work and initiatives forward. So I just welcome other people to be a part of that conversation, to maybe catch something that I'm not necessarily paying close attention to that also could be beneficial to us as we're having this conversation.
All right. Next order of business is the Health Officer and Director's Report, which is in the agenda packet on page 11. And if you have any questions, you can ask Dr. Freiheit. And I don't know if there's anything she wanted to call out.
Nope, just available for questions. Thank you.
Let's see, and then, yes.
Dr. Freiheit, could you speak to Don Lee's public comment about, you're actually at a gathering right now. Is there an increased sort of cooperation and conversation across counties to help fill in what might not come from federal or state resources?
Well, certainly we won't have all the answers after this week, but that is the main topic of conversation and all the breakouts this week. So I'm hoping to learn much more. In particular, this week is focusing on the foundational public health services, which are state dollars, not federal dollars, but still in the governor's budget requiring a cut. So working through some of those issues with the state and with SALFO partners that are here, along with all the other counties. So more to come.
Good question. All right, so we will now update the Board of Health on the subcommittee work, and education and outreach. Any updates you'd like to share?
No major updates. I just want to acknowledge Judge Buckley, who came and spoke on behalf of the Men's Health Proclamation, as well as Keoki, who planned on being here. And I just really appreciate community members stepping forward and engaging with the Board of Health on these important matters. definitely feels more comprehensive to have local voices coming forward and talking about how these issues impact them personally. So I just really appreciated that, and thank you for the opportunity to share the written comment. As far as any progress, we don't have any major updates, but I just wanted to highlight that we had extra participation today.
Great. Yeah, thanks for the great invites. All right, and I don't know, Member Newton, if you have any updates?
Yeah, just a short update. So
This is
the
data subcommittee.
Yeah, the Journey to Health Equity report was released, and it showed up in multiple news publications like the Jolt and Nisqually Valley News, and Hoodline, I believe, and other ones. And reading the coverage of it was really good. A lot of them pulled out some of the information that really stood out to me too. So that was actually really exciting that they were finding the information to be as surprising and as important as I thought it was. So they also, the part of the communication plan was to put it online social media. So I believe Facebook, LinkedIn, X, / Twitter, Insta, were all, it was put on all of those platforms. As far as clicks, Facebook got 929 clicks, LinkedIn had 285, X had 71, Insta had 87. So that was as of end of last month, I believe. So, yeah.
Nice data.
Yeah, and yeah, I asked for comparisons, and the comparisons were pretty good because I think Facebook, the second highest one was like 400 or 500 clicks or something, and that was another public health social service posting. So yeah, so as far as this, I was wondering if any of you guys had a personal story to share about sharing it out in the community yet.
Yes, you'll hear that in my update.
Okay, awesome. So that's great. Yeah, so I think that's the update.
Fantastic.
For that subcommittee.
Great, thanks. And then Clark, are you gonna do
Just if you have any questions, please email Melanie or Dr. Freiheit about that so you can get clarification about the report.
Are you going to be our in-person policy subcommittee update, or should we call on Ty?
I am.
Okay.
So, just briefly, we met last Friday, and so we're sitting with 2016 plans, and we've had staff capacity this year for people to really dig in, right, and do some substantial updating, streamlining, aligning with current state legislation and requirements. And we reviewed Article 2, which is the food safety chapter, and we were high-fiving around the conference table because it was some substantial work to undo sort of the extra muddle and complicated process that happened over many years of running without a review like this. So there's some great efficiencies that I think both restaurant owners and caterers will appreciate. And at the same time, staff were able to hone in on what are the critical food safety items that need to be upheld and had a better focus on those. So that's coming to all of us this summer. But we had a preview and really we didn't have any substantial concerns or input to modify what's coming forward to you. The next project we're taking on is water systems and sewer systems, and it's rather, it's gonna be a bigger project, right? This is the one that's been years in the making, already lots of public process, both with the Board of Commissioners and the Board of Health. But we're gonna spend some time, there's a consultant doing some preliminary study work, and the subcommittee is gonna look at that this summer and have a conversation about balancing capacity of the organization versus priorities and how much do we take on initially. And I'm really excited that we'll move forward that, especially the septic work. That's a long time coming.
Any follow-up questions for anybody? All right, so let's see. So the next item is just discussion, information sharing, and I just wanted to let you know my walk at the Deschutes Falls Park was a hit. I had 2 people show up, my parents. But it was great. We had a wonderful time.
Right?
It was beautiful. I highly recommend it. It's worth the drive. And it's a place that I grew up here and I never saw before, and I thought it was really beautiful. So maybe we can keep every quarter just being like, hey, let's highlight another park. So anyway, so that was my lack of success there. But and then I want to ask Commissioner Grant if she would be able to just share a little bit about the Weaving Stronger Systems of Care.
Yeah, sorry, I'm getting a couple messages. Yeah, I would love to share a little bit about the event. It was a huge success. We had an event on June 5th, Thursday night. We had 88 or 94 total participants, I think is what the final count was. Over 57 partner organizations showed up. And we had multiple, we had, the sheriff was there, prosecuting office was there. We had lots of different people with lived experience, community members, government staff, different youth and family advocates, tribes were there. It was amazing. We had an agenda. We did things like, we kind of talked about a problem statement of, how do we not have people fall through the cracks in Thurston County? And we actually used, highlighted, I was gonna say you should go back and look at the clicks because we highlighted the equity report. We actually used it. The other thing that was very different about this event was that we utilized something interactive PowerPoint presentation with data where it's called Slido. So all of the participants were engaged in the screen, and so we did quizzes, and we used the data from the health equity. So it was, what can you do in Thurston County to improve health equity? What does health equity mean? And so we used the data from some of the data from this and to engage people in those questions. And so, and one of the questions was to share information with each other. And so that kind of framed our conversation that night. The other big thing that we talked about, and I'll just say that, is that we kind of came down with, talking about, we currently have kind of a system of doors, but no front door. And of behavioral health providers and human service providers. And so there was a big, it was very exciting because we had over, all of the people that came stayed through the whole night. It was one of my favorite things about having data was that we were able to have a question in the beginning with an app and a question at the end with an app. And so I was able to see how many people were there when they started and how many people were there at the end. And we had 88 people at the end. And we ended up in small groups and a lot of people engaged, and we were able to come away with a lot of data that, talking about, what are people seeing as things that we could improve within the system, and what are the underlying causes of those things. And so we were able to take some of that data away. One of the other big takeaways from this is we had 2 provider presentations, one by Dennis Neal, who owns Northwest Resources. One thing I will say about that, if you are familiar with Dennis Neal, who owns one of the treatment centers, he talked about what it takes to work within work as a local provider and actually partner with our county, and actually what it took for him to go from one tiny little organization to 5 different locations across our county, and now serving 18,000 patients over the last 10 years. And so what it takes to partner, and what local passion and local dollars can actually do, and an investment of $800,000 in capital funding can actually produce over, a matter of 10 years and what that is actually equates into. And so it was really quite interesting. And then Behavioral Health Resources, Laura Tebow came and spoke and talked about what we're doing in our mental health system and on all of the different things, and talked about, all of the different partnerships they have in the schools, the partnerships they have with our adult programs, the partnerships they have with our housing providers. They partner with housing providers and all across their system. And so it was just really great. I think the biggest takeaways were that, we had an interactive slide where people were able to give us takeaways. And, the biggest themes were that people, we had lots of CEOs there, lots of people who showed up, didn't send their staff. They were actually there to collaborate themselves. And so, we really thought that there's a growing interest in shared ownership across the system. And that collaboration and not competing was on lots of sticky notes, so, we end up with 392 sticky notes on a big thing, right? And that integration is imperative. We need to build a single entry front door. We need to share records and clearly map some pathways. And so that was our takeaway. And it was great. Next one is on September 4th, and we asked the group what they wanted to talk about, and housing beat out crisis services. And so I think that it's going to be housing. So and we're really grateful to Olympic Behavioral Health and Recovery for sponsoring it and for really making it a big event. There, people were very, very excited and are excited to come back. So
Awesome.
yeah, that's good.
That's amazing.
Yeah.
Yeah, that's awesome.
Yeah, any follow-up questions anyone has for her?
I first heard about it like the day before, the day of. Was there any chance we could get like just more heads up?
No, sure.
Yeah,
We
that
tried,
sounded
yeah,
amazing, and I just couldn't fit it in, and I would, I would have loved to try to.
Well, you already got it on. So September 4th, there's your first one. But
there
yes,
we go. I will
we're
write that
building
down.
we're building the capacity to figure out how to get the word out. So
Yeah, it sounded amazing.
Yeah, great.
Nice turnout for your first one.
I
That's
know.
amazing.
We killed it. We killed it. It was great.
Yeah.
We were really excited.
That's awesome.
Yeah.
I just want to say it's really exciting to see the system care work that's happening in the adult services world, which is, I think we've been doing that in the children's services world for a while. That's where I met Dr. Harvey. But adults live so independently that those needs don't always get thought about from the perspective of the system. So it's really exciting.
Yeah. Well, and there was quite a few discussion around the fact that the county used to have meetings that this used to be something that we did. And it was talked about multiple times that this was a monthly meeting that was had, in each system. So housing would have one, and SUD providers and mental health. And then there was a change in the way that we delivered Medicaid services in 2018 that changed the way that happened. And so I think people were just hungry and excited and just we're happy to have the space to collaborate and to connect. And so it was really neat.
Did you want to say something, Member Zanzali Marshall?
I did. I just wanted to say thank you so much, Commissioner Grant, for doing this. I have heard a lot of energy in several spaces within several industries or whatnot that you named, that people were there. People are very excited about this. People are really looking forward to more of an interagency approach to getting things done, especially with what we're facing funding wise, both federally and state. So I kind of want to echo Perla a little bit. I wish I would have known beforehand because I would have been there. I had a conflicting event, but September 4th, I'm hearing, is the next one. And please let me know if you need anything regarding help or background work or following up with people. I would be more than happy to participate in this because it's definitely a long time coming. So I appreciate the work.
Thank you.
All right, so our final thing is that we will now meet in executive session pursuant to RCW 42.30.1402 and Article 1, Section 9 of Thurston County Septic Code. That portion of the meeting is a quasi-judicial body which relates to a quasi-judicial matter between named parties. The board will be in executive session until about 5:20.
We need a full 30 minutes, Josh?
I think so.
I will call the regular meeting back to order at 5:04. And the next order of business is adjournment. May I have a motion to adjourn the June 10th, 2025 Board of Health meeting?
So moved.
Second.
All right. All in favor of adjourning?
Aye.
No opposed, we are done. Bye, guys.
Bye.